All three of us are Navigators, and we partner with the Kansas Association of the Medically Underserved to be certified to do Navigators, and that basically means that we've taken a series of tests so we are knowledgeable, so we can help people make informed decisions as they're filling out their application and they're thinking through their options of what health insurance is best for them.
The Affordable Care Act open enrollment period for 2019 coverage in the health insurance marketplace began November 1st and continues through December 15th. K-State Research and Extension has experts who are trained to help people navigate their way through the various options. On today's Sound Living, signing up for health insurance through the federal marketplace. Sound Living is a weekly public affairs program produced by Research and Extension at Kansas State University. I'm Jeff Wichman. K-State Research and Extension Family and Consumer Sciences agents Joy Miller from the Southwind Extension District in southeastern Kansas, Susie Latta from Marshall County in north central Kansas, and Erin Petersilie from the Walnut Creek District in western Kansas have taken special training to become marketplace navigators. All three were in Manhattan last month for annual conference. K-State Radio Network's Jason Hackett had an opportunity to talk to them about how they can assist Kansans in better understanding their health care options in the federal marketplace. Joy Miller says the federal marketplace is comprised of several insurance companies offering a variety of health plans that qualify for the tax credit premiums and the cost-sharing reductions for those who qualify economically.
So this became an important piece that we could offer our communities for those who are in between jobs or maybe going to college or planning early retirement. Also, it's become a really knowledgeable piece for us for those transitioning from early retirement and on these plans to going into Medicare, because those are kind of some sticky details when transitioning.
Susie?
I think it's just important to remember that through December 15th is the open enrollment for the Affordable Care Act, and I think everybody should check out your different options and think about the cost, the convenience, the coverage. Different plans have different deductibles and different copays and different coinsurance, and so you have to figure out what's right for you. And you have to figure out if you qualify for a tax credit or not. So you don't really get back in taxes, you get back in tax credits, which usually makes your premium more affordable, or you can wait and get it back in your taxes if you want to pay your total premium up front. So what works best for you and your cash flow? I work with people on the state line, and so a lot of our people go to Nebraska for services, and some of the companies, the policies don't work in Nebraska, so you have to keep that in mind as you're making your options. So that's one thing that you really need to know about the doctors in your network, and make sure the doctors that you go to accept the insurance that you're purchasing.
Erin?
So as we keep on this, and as you hear us talk about open enrollment period, we also need to recognize that maybe you are looking at that early retirement that Joy mentioned earlier. That does not mean you are going to go through this open enrollment period. Let's say you're going to use retirement in June. You're not going to go through this open enrollment period here at this point in time. You will have what's called a special enrollment period to deal with those life situations. And it doesn't just have to be retirement. There could be issues of having a baby or getting married or a death in the family. All of those situations can create a special enrollment period in which you will have access to be able to change or get on different insurance as well.
Last year, the three of you counseled people in your communities and districts. Is there something where you have to be certified as a counselor or something like that? And how much money did each of you end up saving people?
All three of us are Navigators, and we partner with the Kansas Association of the Medically Underserved to be certified to do Navigators, and that basically means that we've taken a series of tests so we are knowledgeable, so we can help people make informed decisions as they're filling out their application and they're thinking through their options of what health insurance is best for them. This year in Marshall County, I served 81 families that actually did apply for health insurance, and I saved them collectively in tax credit $609,000. So even if you're already on the marketplace, you still need to redo your application. Your income might have changed or something might have changed, and so you need to shop again. It's not a one time and then you don't have to think about it again. And I just think that people who have health insurance through the open market maybe need to consider if they might qualify for tax credits, because I had a couple come in and they had just left COBRA insurance, and so They didn't think that the marketplace would really be an option for them, but it turned out great. Their income was in the right level, that they qualified for some great insurance that had a reasonable premium and what they found is acceptable as a deductible and copays. So just don't forget it as an option and just be a good consumer and shop.
So I'm going to echo that of being a good consumer. Shop, read those fine prints. But the other important thing to know about as a navigator is we are not there to make the decisions for you. We are there to help explain some of those sort of things for you. But at the end of the day, you need to be comfortable with this and you need to know what it is that you need out of your insurance and what you want to get out of it and what you're comfortable with. But at the end of the day, it is your decision. I did 39 households out in my district. I actually served people from 10 different counties for a savings and accessing $409,752 in tax credits.
Joy?
When I work with people, even though it's not a complicated process, knowing what to expect. So when I've had a tax credit not trigger, and I know it should have triggered, I know to dig deeper. I know who to call to get you to the end of that. So that's where we're beneficial as navigators. We know when to dig or who to call or that something isn't right and how to help file those appeals or download those documents that will work to help with data matching. So I find that's where we're very helpful because we know some of those ins and outs. We can explain why do you qualify or why you don't qualify. This is open enrollment time, but some of the people I've assisted, they don't plan on continuing, and so they don't actively go cancel their policies through Marketplace and their health insurance. And that is a key step, even though you might be going on to Medicare on January 1, and you think, well, I didn't sign up again, and so it'll just go away. And that is not necessarily the truth. You might have to pay back those tax credits. So it's always important to follow up, whether you're beginning a service or ending a service with the Marketplace, so that you don't have to pay extra when you reconcile on your taxes.
So can you give me some ideas of some of the tax credits that some people may not be aware that they're eligible for, that you can kind of identify? Are there certain things? Why would somebody come and talk to you, and as opposed to just, I can just do it myself?
Well, first off, when we're talking those tax credits, you need to be within certain income guidelines, and it's knowing what to count. You can't just look at your modified adjusted gross income off your taxes and think that's all I have to count. If you are somebody that is receiving your Social Security benefits, that is not listed in that modified adjusted gross income, but you need to know that you need to count your Social Security income on that application for the Marketplace. So sometimes it's just knowing those little things. And I'm sure you're thinking, I do not want to have this conversation with somebody. You need to understand that when you come into our offices, it is confidential. We must keep that information private. We cannot share that. When you walk out, we need to make sure that all of your documents go with you. Our business is to get you the best health insurance for your needs.
What's kind of the average that people can end up saving by being part of this?
How much your insurance costs depends on where you live, depends on how old you are, and depends on whether or not you smoke. So that's kind of depending on what the tax credit is. And so basically the tax credit will make your insurance more affordable. So one couple that's like 63 years old, based on their income, they qualify for over $1,000 tax credit. So it just kind of depends. There's no one-size-fits-all answer. It's, based on everybody's situation. And so that's why it's nice to just meet with people one-on-one, because we could talk about you and your situation.
Erin?
And it's not that you can't access these on your own. Most people are very computer savvy and would be just fine walking through this application, and it is very user-friendly in a lot of ways. Sometimes it's just being able to bounce those ideas off and have somebody else look at this of, did I get all of my income? If you don't know that maybe this insurance plan will only let you go to the doctor 5 times before it starts counting the way it's going to do a deductible and all those sort of things, sometimes it's just those added value pieces that become very important to you as a consumer.
The three of you have had this training. Can you talk a little bit about what goes into that training? Because that is helpful to people to understand, okay, this makes you kind of the experts in this.
Okay, so we're laughing, and who's going to have to take this question? Because Because training is difficult. We did initially 20 hours, I believe, when we first became Navigators. And then we spend at least one day all together with the Navigators across the state of Kansas going through things. And when we do that with the other Navigators, we also do it with the insurance companies so that we can ask them some of those questions that we know may be very specific to you. There are weekly updates that we can participate in, whether they are online videos. There is constantly pieces coming out with news and how we handle certain things. So we are in constant contact with that system on the federal level and making sure that we always have the latest information. And then we have a great network of people throughout the state that we can also ask those questions. So when we come across a question and we don't know the answer to it, we have a great resource to be able to get that answered.
I think the most exciting part about its extension is that I also do taxes for low-income families through the Volunteer Income Tax Assistance Program. So it's really cool because I get to see both sides because I help people sign up for health insurance through the marketplace, and then I also reconcile their tax credits when we do their taxes. And so it's really interesting to see if they have to pay back tax credits, if they came out just exactly right, or if they get additional tax credits. And so it's really important that people remember if they do have insurance through the marketplace that they pull off that 1095A form and take it with them to their tax preparer when they have their taxes filed or when they file themselves online, because you do have to reconcile those. Otherwise, you will not be able to enroll again in the coming year and receive tax credits. For the 2019 year, people are no longer mandated to have health insurance. So that means that the laws have kind of changed, and now there's going to be opportunities for insurance companies to offer other types of health insurance. You'll hear lots of different buzz names, skinny plans, light plans, and I think there again, I want consumers to ask questions. Make sure they understand what the health insurance is going to cover. If I get diagnosed with cancer, are they going to pay for my treatment? If I fall down and break my leg, are they going to pay for that? These insurances are not really well regulated, and so they might not be what you think they are. So we want you to talk to somebody who's knowledgeable and make sure you ask questions so you understand. Some people might think they sound too good to be true, and that may be true. But there might be a good place for that. And maybe you just need something catastrophic, just in case something really horrible happens over a short period of time. Or maybe you're a college student, and so you just need a little something to get you by. And so maybe those are right for those people. But every individual situation is different, and so you have to figure out what's best for you. And just make sure you ask questions. And that's why Extension's so great, because we're research-based, we're not biased, we're not selling insurance. So we will help you find accurate information.
Joy?
When looking at plans on the marketplace, people often think they're different from if they sought out this insurance as a private individual. And at least through Blue Cross Blue Shield, they're selling you the same plan on the marketplace as it is if you just went in to their office to purchase it. The marketplace plans are very credible. There's no gimmicks. There's no inflated pricing because you're going through the marketplace. But to get those tax credits, you must go through the marketplace.
Anything we missed out of all of this that we need to still cover, that there's another piece that people need to be aware of?
So when we talk insurance, we always need to be aware of the fraud that is going to happen on this side of things. So when you are going through the marketplace, it is going to check your identity, that you are who you really say you are. You need to remember that in the state of Kansas, it is illegal for people to sell insurance door to door. Now, if you fill out something and says, yes, I want to learn more about this insurance, they are welcome to send somebody to you. But every year, even in our small communities, we will get a phone call that we will have somebody who is selling insurance, who is there illegally, and you need to be careful that you are dealing with reputable dealers so that you don't get caught paying for something that is no good.
I guess I just want to say, if in doubt, call the Kansas Insurance Commission, because they're going to know whether people are licensed to sell in the state of Kansas, and they'll be able to tell you whether a company is legit or not. On another note, remember, if you are going to shop online, it is www.healthcare.gov. So you want to make sure you use the right URL. Otherwise, you're going to get lots of pop-ups, and a lot of people will probably start calling you or sending you emails. So make sure that you use www.healthcare.gov.
That's Susie Latta, the Family and Consumer Sciences Agent for Marshall County in north central Kansas. Susie, along with Joy Miller from the Southwind Extension District in southeastern Kansas, and Erin Petersilie from the Walnut Creek Extension District, have taken special training to become marketplace navigators. For a list of navigators for Kansas, go to coverks.org. coverks.org. And to learn more about the Affordable Care Act open enrollment for 2019, visit healthcare.gov. Sound Living is a weekly public affairs program produced by Research and Extension at Kansas State University. I'm Jeff Wichman, and this is the K-State Radio Network.